Hi, I'm Andrea Leonard. I am a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. And I just wanted to take a couple minutes to talk to you about working with patients who have had head and neck cancer surgery and treatment. So this goes to all allied health and fitness professionals. I personally had thyroid cancer, so I have an incision here, and I remember when I was recovering, I was very afraid to move my neck for fear that I would open up the incision. So we too need to be aware of that in head and neck movements, and also depending on if they've had radiation to this area, and scar tissue and adhesions can actually change the position of the head, which can also affect shoulder range of motion as well as head and neck movements. So first off, before we do any upper body weight bearing exercise, we want to address any range of motion limitations. So it's going to be really important for you to meet with your client, do a comprehensive postural assessment, and then also measure shoulder range of motion with a goniometer. And we have specific outlines for what normal range of motion should be. So if your client is not at least 90% of what range of motion should be, we don't want to place a load either with a weight or a band or even holding a yoga pose until we get complete range of motion back, as that will just potentially limit it even further. If they've had radiation or lymph nodes removed in the neck area, they will be at risk for lymphedema in the neck and into the facial area. So we want to make sure that we always start the exercise program with at least 5 minutes of cardiovascular warm-up at a low intensity, and then we'll begin with this series of upper extremity lymph drainage exercises, because we don't know what the lymphatic system can handle now after everything that it's been through. So we want to introduce frequency, intensity, and duration very slowly and make sure there's no swelling of the neck or the facial area during that time. And then we can add weight or add more time and repetitions as we go along. There won't be any lower extremity limitations because they're not at risk for lymphedema in their lower body. So other than corrective exercise to address muscle imbalances or injuries, they can do anything with their lower body. I do want to say, in the case of somebody who has their thyroid removed, you want to take into consideration that they may have hypocalcemia. So they are going to be at a higher risk of osteoporosis. So we do know that they need to do weight-bearing exercise. If they've had radiation or chemotherapy, that can also cause damage to the heart and lungs. So cardiovascular exercise will be very important. And also, most people, if they've had their thyroid removed, will gain weight and have a good deal of lethargy. So the cardio will help with that much needed energy, as well as losing body fat, and then the strength training will increase their lean muscle mass, which will help increase their overall metabolism. I would also strongly recommend that they see a registered dietitian or nutritionist who can help put together a sensible meal plan for them, which will help with the loss of body fat, but while maintaining lean muscle. So this is just a snippet of what there is to learn when working with anyone who's undergoing cancer surgery or treatment, but specifically those with head and neck cancers. And I'm thrilled that we are now offering live workshops as well as online training in Asia. So I hope you'll take advantage of this and take your fitness training to the next level. Visit us at ceti.teachable.com.